Welcome back to the Deep Dive. Today, we're taking a deep dive into something uh, absolutely vital for your body.
Yeah, something that's surprisingly complex.
Vitamin B12.
Yeah,
It's essential, often overlooked, really, and figuring out its role in, our modern diets, it can be tricky.
totally. And we've got a fantastic source guiding us today. It's a really comprehensive guide, actually written mainly for physicians.
Oh, interesting.
Yeah, it's packed with the latest research, clinical insights. It really helps unpack the nuances of B12 in, well, the world today.
Absolutely. So our mission is clear.
Yeah,
We're going to try and cut through all the noise,
right.
understand what B12 does, where it actually comes from, including some surprises there,
Definitely some surprises.
how your body uses it, and crucially, who's really at risk of deficiency. Because it might not be who you think.
Exactly. And we'll get into diagnosis, management, what it all means for you, in your own food choices.
Perfect. And it connects to that bigger picture, doesn't it? Like that quote in the Sources Forward, Thomas Edison.
Oh, yeah, that's a great one. The doctor of the future will give no medicine, but will interest their patients in the care of the human frame, in diet, and in the cause and prevention of disease. And B12 fits right into that whole proactive, prevention-focused approach to health.
Love that. Okay, let's jump right in then. So B12, at its core, what's it actually doing for us?
Okay, so vitamin B12, its other name is cobalamin. It's water-soluble.
Hmm.
And its job is, well,
Fundamental.
fundamental how? It's crucial for making healthy red blood cells, really key for synthesizing your DNA, and super important for keeping your nervous system working right.
Nervous system.
Yeah.
Like brain function.
Brain function. Yeah, and also maintaining the protective coating around your nerves. That's the myelin sheath. Plus, it's involved in energy metabolism, converting food into energy.
Okay, wow. So basically essential for, like, everything.
Pretty much.
Now, the origin story, where does it come from? This is where I think the first sort of aha moment is in the source material.
This is really key. Vitamin B12 isn't made by plants and animals. They don't make it themselves either.
Wait, really? Not animals?
Nope. It's synthesized only by specific kinds of bacteria and archaea, these tiny microbes.
What?
Animals get it by eating these microbes, maybe from soil on their food, or it's made by microbes in their own gut, and then it builds up, it accumulates in their tissues.
Huh. And fish?
Same idea, but through microbes in the water, they get eaten. B12 moves up the food chain, accumulates in the fish.
So animals are more like storage units.
Yeah.
For bacterial B12, not the original factory.
Exactly. They're carriers, accumulators. That's a great way to put it.
Okay, so how much of this bacterially made animal stored vitamin do we actually need?
Right, the RDA, the recommended dietary allowance. For adults 14 and up, it's 2.2 micrograms per day.
Micrograms, so tiny amounts.
Very tiny. It goes up a bit during pregnancy to 2.45, and during lactation up to 3.2 micrograms a day. There's also an ER, estimated average requirement, which is 2.0 millisecond a day for adults.
Okay.
But here's the important bit, the source flags. These numbers assume your body absorbs it normally.
Assuming normal absorption,
Or
which I gather from a source isn't always a given.
not at all.
So traditionally then, where have humans gotten most of their B12?
Traditionally, yeah, it's been animal-based foods just because that's where it accumulates.
Yeah.
Meat, poultry, fish, eggs, dairy, the standard stuff. The sources even give examples with really high amounts. Cooked beef liver, off the charts, like 70 to 83 micrograms in a serving.
Wow. Okay, liver's packed. What else?
Tuna's good, sardines, salmon. They're all decent sources. Several micrograms per serving.
So, okay, if you eat those things regularly, are you pretty much set for B12, just automatically covered?
Well, that's what you'd think, right? But it's not quite that simple, and the source really digs into this.
How so?
While those foods do give you B12, the guide points out potential trade-offs.
Trade-offs like what?
Well, eating a lot of some animal products, especially things like red and processed meats, they're often high in saturated fat, sodium, preservatives.
Right.
And frequent consumption is linked to higher risks of chronic diseases. Heart disease, some types of cancer, like colorectal.
Yeah.
The source mentions specific compounds, too, like TMAO, which comes from carnitine and choline in meat, affects your gut bacteria, linked to heart risk. Or AG's advanced glycation end products from high heat cooking, they cause oxidative stress, inflammation.
Okay, so you get the B12, which is good, but potentially other stuff that isn't so good.
Exactly. The source calls it a nutritional advantage, but with health trade-offs. Plus, these foods can crowd out healthier, fiber-rich plant foods in your diet.
Makes sense. Does the source compare, like, B12 versus the risky stuff.
Yeah, there's a comparison mentioned, like ground beef gives you some B12, but also saturated fat and cholesterol, whereas something like fortified nutritional yeast or nori seaweed can give you similar or even more B12 with hardly any of that.
That's a pretty stark
And
difference.
that's not even touching the environmental footprint, right? Red meat's impact is huge compared to those plant-based options.
Yeah, absolutely. Okay, let's circle back to the microbes. If bacteria make it, what about getting it from plant sources directly? Can we rely on those? This is a huge question for so many people now.
It really is, and it's a major focus in the guide. They talk about exploring these novel plant sources. Remember, plants don't make it.
Right, but maybe they can pick it up from the environment.
Precisely. They can interact with the B12 producing bacteria around them.
Okay, so which plants show promise?
Well, certain types of algae look interesting. Nori, the seaweed for sushi,
Yeah.
discussed as potentially having bioavailable B12. The source suggests maybe 5 grams a day could contribute, but the B12 content varies massively, depends where and how it's grown.
Okay, so nori is a maybe, but inconsistent. What else?
Chlorella, another
Yeah.
type, a microalga. That looks more promising.
Mhm.
Apparently, it accumulates active B12 through symbiosis with bacteria. Studies suggest it can actually raise B12 levels in vegans.
Active B12, that's key. Okay, nori, chlorella, potential contributors. Now, there's another algae people talk about a lot, spirulina. The source had a warning about that, right?
Yes, this is super important for people to know. Spirulina is often marketed as a B12 source, but the guide is very clear. It contains B12 analogs, sometimes called pseudo-B12,
Pseudo B12.
meaning it looks similar structurally, but it's not biologically active for humans. It doesn't work in our bodies. Worse, it can actually interfere with your absorption of the real active B12.
Wow. So relying on spirulina for B12 is actually counterproductive?
Completely. Big mistake. Avoid it for B12 purposes.
Okay, crucial heads up there. What about mushrooms? Can we get B12 from fungi?
Well, some mushrooms can have modest amounts, but again, it's acquired from bacteria in whatever they're growing in.
Not made by the mushroom itself.
Right. Dried shiitake mushrooms are mentioned. They might have bioavailable B12, but again, the amount varies based on cultivation. Golden chanterelles, black truffles, also small amounts.
But not like regular button mushrooms.
The source says many common ones, white button, oyster, porcini, have only trace amounts, or mostly the inactive forms. So pretty negligible contribution.
Okay, so like algae, mushrooms are specific, variable, and probably not a primary source. Any other edible plants mentioned?
Sea buckthorn and Cydia couchgrass are noted as having potentially high levels, probably due to plant microbe interactions, but needs more research to confirm bioavailability for us.
Right. And what about fermented foods? Things like tempeh, kimchi, kombucha, they involve microbes?
Yeah, good question. The source is very direct here, too. Traditional fermented plant foods might have traces of B12 from the microbes involved,
Right.
but often it's the inactive form again, and the levels are super variable, usually way too low to meet your daily needs. So, bottom line, unreliable sources.
Unreliable, got it.
There's research into maybe fortifying these foods during fermentation with B12 producing bacteria, which sounds cool, but it's still early days. Needs human trials.
So for now, don't bank on your sauerkraut for B12. It really sounds like relying purely on natural plant sources is, well, pretty unreliable.
It is challenging because of the inconsistency, the inactive forms, and the source points out it depends so much on external factors, the soil, microbes, fertilizers, how much it's washed, because the plant isn't the source, the bacteria are.
Right. And processing, like drying or fermenting, can change things too.
Exactly.
Okay, so given all these challenges with natural plant sources, fortification seems like it must be a really key strategy. What exactly is that, and why is it so crucial for B12?
Fortification is basically just adding nutrients, like B12, to everyday foods. And it's been a super effective public health strategy worldwide for preventing deficiencies.
Makes sense.
For B12, it's incredibly important, especially for people eating fewer animal products or in places where deficiency is just really common. The sources really hammer this home, especially for somewhere like India.
What kinds of foods get fortified? Are there examples mentioned for India?
Yeah, the source lists things like fortified plant milks, soy, almond, oat milk. They usually add a useful amount, maybe 0.5 to 1.5 micrograms per 100 milliliters.
Okay.
Fortified nutritional yeast is another big one. Often gives you 1 to 2.4 micrograms in just 10 grams, which is a couple of tablespoons.
Nutritional yeast, yeah, people use that a lot.
Breakfast cereals, some fruit juices, vegan butters, even fortified wheat flour, atta, is mentioned as an option available there.
Is this something the government requires in India? Or is it voluntary?
Good question. The FSSAI regulations allow B12 fortification, but generally it's not mandatory, unlike, say, how some grains might have to be fortified in other countries. And the sources, they strongly argue for making it mandatory and widespread for staple foods in India. They call it a critical step to tackle the silent epidemic of B12 deficiency.
Silent epidemic. And you mentioned a number earlier.
Yeah.
What was it?
Yeah, the source quotes figures suggesting over 70% of the population in India might be affected.
70%? That's huge. Why silent?
Because, the deficiency can brew for years without obvious symptoms, while slowly causing harm, especially neurological harm.
Right.
And when symptoms do pop up, they can be vague, like tiredness or mistaken for other things. So, on a population level, with so many affected but often undiagnosed, it becomes this invisible or silent problem.
Is there any drawback to fortifying everything?
Well, one potential downside mentioned is that if you fix the anemia part of B12 deficiency with fortified foods, it might hide the fact that someone is also deficient in, say, iron or folate, delaying that diagnosis.
Oh, okay. So it fixes one problem but could mask another. Important to know.
Definitely.
Okay, so besides fortified foods, what about just taking a supplement? Who really needs a B12 supplement?
Yeah, supplements are often necessary, especially for high-risk groups. That definitely includes vegans and vegetarians. Older adults, too, because absorption often declines with age. And anyone with medical conditions or taking medications that mess with absorption. Since most natural plant sources are unreliable, supplements or fortified foods are pretty much essential if you're on a fully plant-based diet.
What are the different types? I hear names like cyanocobalamin, methylcobalamin. It's confusing.
It can be. Cyanocobalamin is the most common one. It's synthetic, very stable, cost-effective. Your body takes it and converts it into the active forms it needs.
Okay, so standard, reliable. What about methylcobalamin?
Methylcobalamin is one of those active forms, so your body can use it directly. It's sometimes preferred, maybe if someone has genetic issues affecting that conversion step, or if they have neurological symptoms already.
But for most people.
For most people, cyanocobalamin works just fine and is usually cheaper. Both are effective. There are other forms, too, like hydroxycobalamin, often used in injections, and adenosylcobalamin, another active form.
Okay, so cyano is the workhorse. Methyl might be used in specific cases.
Pretty much, yeah. The source notes that a lot of supplements in India actually use methylcobalamin, like brands called Neurokind.
And how do you take them? Just swallow a pill?
Pills or capsules are common, yeah. But sublingual tablets, the ones you dissolve under your tongue, are highlighted as being really convenient and effective.
Why end of the tongue?
Especially helpful if you have absorption problems in your gut, because it can kind of bypass parts of the digestive system, get absorbed directly into the bloodstream there.
Interesting.
And then for really severe deficiency or certain absorption disorders, you've got intramuscular injections, IM shots, that deliver it right into the muscle.
Okay, that sublingual route sounds useful. Now, the source also mentioned taking B12 with folate. Vitamin B9? Why are those two linked?
Yeah, they're like metabolic partners. They work together on really crucial stuff like making DNA and red blood cells.
How does that link work?
If you're low on B12, it actually traps folate in a form your body can't use. So you end up with a functional folate deficiency, even if you're eating enough folate.
Whoa, okay.
And here's the danger. If you take high doses of folic acid, that's the synthetic form of folate often used in supplements and fortification, without fixing the B12 deficiency.
Yeah.
It can fix the anemia symptom because it overcomes that folate trap, but it masks the underlying B12 deficiency.
So blood count looks better, but
the B12 deficiency is still there,
Yeah.
potentially causing irreversible neurological damage, and you wouldn't know it from the blood count.
wow, that's really serious, hiding nerve damage.
It is. That's why it's so important to check B12 status before giving high-dose folate, especially if someone has neurological symptoms. The source actually recommends using L-methylfolate, or 5-MTHF, instead of folic acid sometimes.
Why L-methylfolate?
It's the active form of folate, so it bypasses some of the conversion steps that can be affected by common genetic variations, potentially making it more effective for some people.
Okay, good to know. So we know the source is supplementation. Let's talk about getting it from food or a pill into your system. How does that absorption actually happen?
Right. We know bacteria make it, animals store it. How do we actually get it inside?
And wait, what about the bacteria in our own guts? Don't we have B12 making bacteria down there?
We absolutely do. And that's another one of those surprising points the source brings up. Bacteria in your large intestine, your colon, do make B12.
So, problem solved.
Not quite. Here's the kicker. It's generally not bioavailable to us.
Why not?
Think of your digestive tract like a one-way street. B12 absorption, the part where it actually gets into your bloodstream, happens mostly way upstream. In the last part of your small intestine, the terminal ileum,
Okay.
the B12 made by bacteria way down in your colon, it's past the main absorption site. So most of it just continues down the street and gets excreted.
Yeah.
You can't rely on your own gut bacteria for your B12 supply.
Huh. Fascinating. It's being made right there, but we can't use it. So how do we absorb it properly back up in the small intestine?
Okay, there are two main ways. The first is called active absorption. This is how your body handles the smaller amounts you typically get from food. It's kind of complex, like a specific key and lock system.
How did that work?
First, stomach acid frees the B12 from the food proteins it's bound to. Then a special protein made in your stomach called intrinsic factor acts like a key holder. It binds to the B12.
Okay, B12 plus intrinsic factor.
Right. This little package travels down to the end of the small intestine, the ileum, where there are specific receptors like special locks or doors that recognize the intrinsic factor and let the B12 complex into your bloodstream.
Got it. A specific targeted process.
Exactly. But it's saturable, meaning there are only so many locks or doors that can only handle so much B12 at once. The max you can absorb actively is maybe around 2 micrograms per meal or dose.
Okay, so that efficient system has a capacity limit. What's the second way then?
The second way is passive diffusion, and this is super important, especially for understanding why high-dose oral supplements actually work.
Passive diffusion, meaning?
It means that a small percentage, maybe about 1 to 5%, of the B12 present can just sort of seep across the intestinal wall directly into the bloodstream. It doesn't need intrinsic factor, doesn't need those specific receptors or doors.
Oh, so it bypasses the main system.
Exactly. So think about it. If that main active system isn't working right, maybe because of pernicious anemia where you don't make intrinsic factor, or after stomach surgery, or even if it is working, but you just flood the system.
Like with a big supplement dose.
Right. If you take a huge oral dose, say 1,000 micrograms, even if only 1% or maybe up to 5% gets absorbed passively.
That's still 10 to 50 micrograms.
Precisely, which is way more than your daily need of around 2 micrograms. It's enough to overcome a deficiency, even if your active absorption is completely shot or just saturated. Passive diffusion is the backup route that high doses leverage.
That makes so much sense now, why those 1,000 millisecouls exist. Okay, so what things can interfere with these absorption processes?
Quite a few things, actually. Dietary stuff like lots of soluble fiber, alcohol, tannins. You find those in coffee and tea. They can hinder it a bit.
Okay.
But medical conditions are a big factor. Anything affecting your stomach, low stomach acid, damage from gastritis or H. pylori infection, or conditions hitting the small intestine like Crohn's disease, celiac disease.
Makes sense if that's where absorption happens.
Yep. Surgery that removes parts of the stomach or the ileum. Pancreatic problems can affect it too. And just getting older, stomach acid tends to decrease. Intrinsic factor production can go down. That's a big reason why older adults are high risk.
And medications, you mentioned those earlier.
Huge culprits. Long-term use of metformin for diabetes, especially higher doses, like 1,500 milligrams or more, for 5+ years. And those common acid-reducing drugs, proton pump inhibitors, PPIs, or H2 blockers. Using them for a year or more significantly increases risk.
Wow. Okay, lots of potential roadblocks. Once B12 does get absorbed, where does the body store it?
Primarily in the liver. That's the main storage depot. Maybe 50–60% of your total body B12 is kept there.
And elsewhere.
Smaller amounts in muscles, brain, kidneys. But the total amount stored in your whole body isn't actually that large. Typically only about 2 to 5 milligrams.
Milligrams, okay. So not a huge reserve. How long can those stores last if someone completely stops getting B12? Like, say, they go strict vegan overnight and don't supplement.
This is the really sneaky part about B12 deficiency. Your body is actually pretty good at conserving B12.
How?
There's a recycling process called enterohepatic circulation. B12 gets secreted into your bile, but then it gets reabsorbed further down in the intestines, so it goes around again. Because of this recycling and the fact that daily losses are pretty minimal, your existing stores can last a surprisingly long time.
How long are we talking?
The sources estimate typically 3 to 5 years before you'd start seeing clear clinical signs of deficiency.
3 to 5 years. Wow.
Yeah. Now, if that recycling system is broken, like in pernicious anemia where you can't reabsorb it properly, then stores can run out much faster, maybe just months to a year.
Okay, so you can feel okay for a long time while things are slowly declining. That makes early detection really hard.
Exactly.
On the other side of the coin, what about taking too much B12? Can you overdose? Is it harmful?
Generally, no. B12 is water-soluble. What your body doesn't need, it usually just excretes in your urine.
So no real risk.
Because it has very low toxicity, there's actually no tolerable upper intake level, or UL, set for B12 from food or supplements for healthy people. High doses are used safely all the time to treat deficiency.
Okay.
However, the sources do point out a few nuances, some things from research worth being aware of.
Like what? Any concerns?
Well, they mentioned that people with chronic kidney disease might not handle or metabolize B12 normally. More interestingly, some large studies, observational ones mostly, have found an association between very high levels of B12 in the blood, not necessarily from supplements, just high measured levels, and a higher risk of overall mortality, especially in older adults.
Whoa, really? Higher risk of dying.
An association, yeah. And some other observational studies hinted at a possible link between really high supplement doses and maybe a slightly increased risk of certain cancers, like lung cancer in men. But these findings are kind of debated, need more research, and it's correlation, not necessarily causation.
That sounds a bit worrying, though.
It's important context. Sometimes a very high B12 level in the blood might actually be a sign of some other underlying illness rather than the B12 itself causing the problem, you see.
Okay. A marker, not the cause.
Potentially. And the sources balance this by mentioning other big studies, like the B-Proof trial. That one looked at long-term B12 and folate supplements in older adults and found no adverse effects on things like bone fractures or heart disease risk.
So the evidence is a bit mixed on the super high end.
Kind of. The general clinical take seems to be using high doses to treat a diagnosed deficiency. Safe and absolutely necessary. Just randomly megadosing yourself with huge amounts if you don't need it, maybe approach with a bit more caution. And if your blood tests show consistently high B12 without you taking supplements, it's worth figuring out why.
Okay, that makes sense. Therapeutic doses are fine. Unnecessary megadoses, maybe not. Investigate high levels. Got it. Let's shift now to what happens when levels do get too low, actual B12 deficiency. What does that look like?
Right. When you're deficient, your body just doesn't have enough active B12 to do all those vital jobs we talked about, nerves, blood, DNA. And it's a really widespread problem. The sources keep stressing how often it's underdiagnosed, especially in places like South Asia.
How low is low? How is deficiency actually defined?
The cutoffs can vary slightly between guidelines, but generally, a serum B12 level below 200 picograms per milliliter PGML is considered deficient.
Okay, under 200.
Levels between 200 and 300 PGML, that's often called borderline or the gray zone, that definitely needs a closer look. And the sources mention like up to 15% of people might have deficiency even before they have obvious symptoms.
And you mentioned earlier this crucial difference between just low blood levels and functional deficiency.
Yes. This is one of the biggest takeaways from the guide, I think. Biochemical deficiency is just having that low serum B12 number. Functional deficiency is different.
How so?
It means your serum B12 level might look normal. Maybe it's in that 200, 300 gray zone, maybe even higher. But down at the cellular level, your body isn't using the B12 effectively.
How do you know it's happening?
It shows up when you measure other things in the blood-specific metabolic markers. The main ones are methylmalonic acid, MMA, and homocysteine. If those are elevated, it signals that B12 isn't doing its job inside the cells, even if the serum level looks okay.
Wow. So you could have a normal B12 test result, but still be functionally deficient.
Absolutely. The sources estimate that maybe up to 30% of people with normal serum B12 could actually have this functional metabolic deficiency.
That's unsettling. So your standard test might miss it. What kind of symptoms would someone get if this is going on?
Well, remember, those stores can last years, so symptoms often creep up slowly. But once they hit, especially with functional deficiency, they can be serious. And that nerve damage risk is real, potentially irreversible if it's not caught and treated.
Okay.
And the source highlights that you can get neurological symptoms, the nerve-related ones, even before you develop anemia or other classic signs. That's the subclinical stage, which really drives home why early detection is so important.
So what are the specific symptoms people should be aware of?
They can affect a few different systems. Hematological, that's blood-related. You can get megaloblastic anemia, where red blood cells get big and weirdly shaped, sometimes low white cells or platelets. A key early sign doctors look for under the microscope is hypersegmented neutrophils, and a sore red tongue glossitis can happen too.
Okay, blood stuff. What else?
General symptoms are pretty common, but vague. Fatigue, weakness, looking pale, feeling short of breath, dizziness. Stuff that could be anything, really.
Right. Easy to dismiss.
Exactly. But the most concerning ones are often the neurological symptoms because of that risk of them becoming permanent.
Like what specifically?
Peripheral neuropathy is a big one. Numbness, tingling, burning, often starting in the hands and feet. Cognitive problems are really common too. Memory issues, confusion, trouble concentrating.
Brain fog kind of stuff.
Yeah, exactly. Mood changes can happen, depression, irritability, even psychosis in severe cases. And problems with balance and walking unsteadiness, falls, can really impact mobility.
Wow, that's a huge range. From fatigue to psychosis and falling. Does it progress in stages?
Yes. The source lays out about 4 stages to show how it develops. You start normal, then you might hit. Subclinical deficiency labs might show slight changes, like MMA or homocysteine starting to rise, maybe before you feel much. Then early deficiency B12 might be borderline, labs are more clearly off, maybe you get those vague symptoms or mild neurological stuff. And finally, severe deficiency B12 is very low, labs are way off, you've got clear anemia, and significant, potentially irreversible neurological problems.
Definitely want to avoid that severe stage.
Absolutely. Prevention and screening are key.
So who is most likely to end up in one of these deficiency stages? Is it really just vegans and vegetarians?
That's the common myth, right?
Yeah.
But the source is super clear. Nope. While vegans and vegetarians are definitely at the highest risk if they're not careful about supplements or fortified foods, deficiency is incredibly widespread and hits many other groups too. You mentioned India's high rates. That's partly due to the large vegetarian population, but not only that.
So who else is high risk?
Older adults, especially over 60. Absorption just tends to decline. People with GI disorders, Crohn's, celiac, atrophic gastritis, pancreatic problems, anyone who's had stomach or intestinal surgery like gastric bypass, all of those interfere with absorption.
Okay.
Pernicious anemia, that autoimmune condition attacking intrinsic factor, is a major cause of severe deficiency.
Right.
Those medications we talked about. Long-term metformin, long-term PPIs, or H2 blockers for acid reflux. Huge risk factors. Chronic heavy alcohol use damages the gut and liver.
What about genetics?
Yep, genetic factors too. Variations in genes like MTHFR can affect how you metabolize B12 and folate. Having other autoimmune conditions like type 1 diabetes or autoimmune thyroid disease increases your risk of pernicious anemia.
And globally?
Globally, it's a massive issue in many low and middle income countries. Remember those stats. 40% in Latin America, 70% in Africa, 80% in South Asia. Often linked to limited access to animal foods, lack of fortification, and maybe higher rates of gut infections affecting absorption.
Those numbers are just staggering. 70–80%. What else contributes?
The sources point to a few other modern factors. The global shift towards more ultra-processed foods, they're often low in B12 and might even impair absorption. Poorly planned plant-based diets that rely on those unreliable sources with pseudo-B12.
Right, like spirulina.
Exactly. Socioeconomic factors play a role. Low income often means less diverse diets, and just a lack of awareness, sometimes even among doctors. Oh, and even how we cook B12 is sensitive to heat, so very prolonged cooking might degrade it.
Okay, here's a key question that based on something you mentioned earlier. Can people who eat plenty of meat still become deficient?
Yes. Absolutely. This is a really crucial point the source makes. Deficiency happens even in populations that eat meat regularly.
How? Why?
Several potential reasons. Those genetic variations affecting metabolism. Maybe changes in modern farming, less B12 in the soil for animals to pick up, or the type of B12 used in feed affecting what ends up in the meat. The source mentions lower B12 levels in some commonly eaten meats, like chicken often being lower than, say, mutton or seafood.
So just eating some meat isn't a guarantee.
Not at all. The source gives this striking example from Telangana in India. Apparently, 98% of people there were non-vegetarian, but B12 deficiency was still rampant. They suspected it might be linked to relying heavily on chicken, which is generally lower in B12.
Wow.
It really reinforces the message. You need to think about B12 status regardless of your diet. Don't assume you're fine just because you eat meat.
Regardless of your diet. Okay, that's a huge takeaway. So how do doctors actually diagnose this invisible epidemic, especially if the standard serum test isn't the whole story?
Right. Diagnosis really needs a combination approach. You need the clinical picture symptoms, risk factors, plus the right blood tests.
Starting with,
Starting usually with that serum B12 test. It's the most common first step.
but we know its limits. Low is low, but normal might not be normal enough.
Exactly. Below 200 pgml, pretty clearly deficient.
Mhm.
But that 200-300 gray zone, or even if it's above 300 but the person has strong symptoms or risks, that's where you need to dig deeper with the functional markers.
Okay, functional markers. Remind me what those are.
The main one, and the source says it's highly specific, is methylmalonic acid, or MMA.
MMA. How does that work again?
B12 is needed for a specific metabolic step. If you don't have enough active B12 working inside your cells, MMA doesn't get processed properly and it builds up in your blood. So high MMA, especially with borderline or low normal B12, is a really strong sign of functional deficiency.
Okay, MMA is key. What else?
Total homocysteine is another one. It also rises when B12 is deficient because B12 helps convert homocysteine to something else, but it's less specific than MMA.
Why less specific?
Because homocysteine can also be high if you're low in folate or vitamin B6, or if you have kidney disease or thyroid problems. So it's useful information, but MMA is usually considered more directly tied to B12 status.
Gotcha. Are there tests that look just at the active B12?
Yes, there's holotranscobalamin, or holo-TC. That measures the B12 is actually bound to its transport protein, ready to be delivered to cells. It's considered more sensitive, might detect deficiency earlier than total B12, but it's not as widely available or commonly used as MMA yet.
Okay, so the strategy is check serum B12. If it's low, treat. If it's borderline, or if there's symptoms despite a normal level.
Then you check MMA and maybe homocysteine. If those functional markers are elevated, that confirms a functional deficiency, and you treat. And importantly, you also investigate why they're deficient. Is it diet? Is it malabsorption, like pernicious anemia?
Makes sense. Okay, so once it's diagnosed, how do you manage it? Can the damage actually be reversed?
The good news is deficiency is often completely reversible if you catch it in time, but the treatment really depends on the cause. Is it just not getting enough in the diet? Or is the body unable to absorb it?
Okay, what if it's an absorption problem, like pernicious anemia or after stomach surgery?
Right. In those cases, just taking regular oral pills usually won't work well because that absorption pathway is broken. So typically you need parenteral therapy, meaning injections. Yep. The source mentions standard protocols using 1,000 micrograms of hydroxycobalamin or cyanocobalamin. Often it's like daily shots for a week, then weekly for a month or so, and then maybe monthly injections for life if it's a permanent condition like pernicious anemia.
Okay, injections for malabsorption.
Ugh.
What if it's purely dietary deficiency, like a vegan who wasn't supplementing?
In that case, high-dose oral B12 is actually very effective, according to the source.
High dose, like those 1,000 microgram pills?
Exactly. They recommend daily oral doses of 1,000 to 2,000 micrograms of cyanocobalamin.
Okay, but wait, the RDA is only like 2.4 micrograms. Why on earth do you need 1,000 or 2,000 micrograms in a pill? That seems like massive overkill.
It sounds like it, right? But it goes straight back to that passive diffusion. Remember, the RDA assumes that efficient active absorption pathway is working, but it maxes out at about 2 micrograms.
Right, the key and lock system.
But passive diffusion lets about 1/5% of any amount just seep through. So if you take 1,000 microgram pill, even if your active absorption is saturated or not working, that 1/5% passive absorption nets you 10 to 50 micrograms.
So you're using the inefficient backup pathway, but flooding it with so much that you still get more than enough.
Precisely. It's enough to rapidly rebuild your stores and fix the deficiency. And it's safe because the excess just gets peed out.
That finally clicks. Okay, so that's for treatment. What about just prevention for people at risk, like vegans or vegetarians?
For prevention, yeah. The source recommends a consistent strategy. Definitely include fortified foods regularly. Aim for maybe 2-3 servings a day, getting about 4-6 micrograms per serving total from those.
Okay, fortified foods and supplements.
And take a reliable supplement. They suggest options like a daily supplement of maybe 30 to 100 micrograms. Or another common strategy is taking a larger dose less often, like 1,000 micrograms just twice a week. Oral, chewable, sublingual, all are fine for prevention.
Okay, consistent intake is key. How quickly do people feel better once they start treatment?
It varies. The blood-related stuff, like anemia, usually starts improving pretty quickly within weeks, maybe up to 8 weeks.
But the neurological symptoms?
Those take much longer. The source says typically 6 weeks to 3 months minimum to even start seeing improvement. And sadly, if the nerve damage was severe or went on too long before treatment, some of it might not fully recover. It might be permanent.
Ugh. That really underscores why catching it early is so incredibly important.
Absolutely critical. Don't wait for severe symptoms.
Okay, so for prevention, especially on plant-based diets where natural sources are tricky, what's the overall recommended approach? It sounds like a mix of things.
Yeah, it's a multi-pronged strategy because relying on just one thing might not be enough. The core is reliable intake through either fortified foods or supplements. That's non-negotiable for plant-based diets, according to the source and major nutrition bodies. Studies like Epic Oxford clearly show vegans without supplements are at highest risk.
Okay, fortified foods and lower supplements are the base. What else?
Then you can consider those novel potential sources like specific nori, chlorella, maybe some shiitake as complementary. Think of them as maybe adding a bit extra, but don't rely on them as your primary source because of all that variability and bioavailability uncertainty we talked about.
Right. Base covered, potential extras. Anything else?
Monitoring. Regular testing. Given how much individual factors matter for absorption and needs, the sources advise getting blood tests, serum B12, MMA, maybe holo-TC, and homocysteine, perhaps every 6 to 12 months.
To catch problems early.
Exactly. Catch any dip early before symptoms start and adjust your strategy if needed. The source even shows an example daily meal plan using fortified foods and novel sources, and while it could theoretically meet needs, it really highlights the variability and why monitoring or consistent supplementation is safer.
Okay, that makes sense. Now, zooming back out to India with that incredibly high prevalence, what does the source suggest needs to happen on a public health level there?
They make a really strong case for population-level interventions. The top recommendation is mandatory, widespread fortification of staple foods.
Like adding B12 to things everyone eats, like flour or rice?
Exactly. They see it as the most practical, scalable way to tackle such a widespread silent epidemic. Alongside that, they recommend scaling up targeted supplementation programs for high-risk groups, pregnant women, elderly, maybe integrating it into existing health schemes.
What else?
Public awareness campaigns are crucial, educating people and doctors, busting myths, improving monitoring and surveillance within the healthcare system, and investing in more research, especially on those plant-associated sources. The idea of universal fortification is really pushed, given how many people are affected.
It sounds like a major public health challenge requiring a big response.
It really does.
Okay, this has been incredibly informative, a real deep dive. If you had to boil it down, what are the absolute key things you hope listeners take away about B12?
Okay, key takeaways. 1, B12 is absolutely vital, especially for your nerves and blood. 2, deficiency is way more common than you think, hitting all sorts of people, not just vegans. Age, meds, gut issues are huge factors.
Right.
3, symptoms can be sneaky, but the consequences, especially nerve damage, can be severe and permanent if you don't treat it. 4, diagnosis needs more than just that basic serum B12 test. You need to look at functional markers like MMA, especially if levels are borderline or symptoms exist.
Okay, and the last one?
And finally, 5, ensuring you get enough B12, especially with diets changing, requires being proactive and informed. That means relying on evidence-based strategies, fortified foods, reliable supplements, and monitoring, because most natural plant sources just aren't dependable on their own.
It really sounds like knowledge and proactive steps are power here.
Totally. And the source is actually quite positive on this front. It emphasizes that B12 deficiency is entirely preventable, even within a totally plant-based diet. If you use these strategies, fortification, supplementation, monitoring, you can absolutely thrive.
That's good to hear.
And managing nutrients like B12 correctly allows people to embrace more plant-predominant diets, which have huge benefits, not just for personal health, but for planetary health, too.
Yeah.
Healthcare providers really need to be partners in guiding people through this.
Absolutely. Okay, to wrap up, let's revisit that striking phrase from the source. B12 deficiency reaching near-pandemic levels in some places, an invisible epidemic. What does that make you think about, bigger picture?
It's a powerful thought, isn't it? When something so fundamental, a basic vitamin, is deficient on such a massive scale, what does that say about our modern food systems, our diets? where we focus our healthcare efforts. Does this silent epidemic maybe signal issues with food access or equity, or maybe a lag in how public health keeps up with rapid dietary shifts? It makes you realize how something seemingly small, like understanding a vitamin, connects directly to these huge challenges around sustainable food, health equity, and the real power of focusing on prevention before disease takes hold.
A lot to think about there. Well, thank you so much for taking us through this deep dive into vitamin B12.
Always a pleasure. Lots to unpack there.